Something we do early in the rehab process here for knee, ankle, or direct hip injuries is some stationary manual exercises, okay? The reason we like manual exercises is because we can provide constant range of motion tension, different than maybe a band, which might not do that, or a weight that the vector of gravity will change based on where your leg is in space, okay? So there's a handful of exercises that are very similar to ones we give for Therax programs that we like to do because they have the highest EMG on recordings for the anterior and posterior glute fibers, the deep hip external rotators, then also the glute med and the glute max. Okay, so the first one we're going to do in a nice stable position here, shoulder in line with hip, is I'm going to hold the outside of her hip, and Jan will do a side plank this way. Okay, so we are just doing very slow push concentric clams. We will then do a ball internal rotation, just like in Therax, to do anterior fibers of the glute med. Okay, we will then do a side abduction lift, pressing straight to the ceiling here. Okay, we will do a prone internal rotation, bending of the knee. She's pulling in towards me this way. Good, and then I really like doing a split pelvis single leg hip lift on the back, especially for gymnasts with different issues for splits. She bends one knee up, okay, and she's driving up through the ceiling and I'm resisting on the distal end of her femur. Okay, so these are all pretty good to do in the clinic for the first few weeks. We quickly want to progress these though to having eccentric and some dynamic rhythmic stabilizations. Okay, so we'll go back to the starting position. Okay, and then we'll do eccentric up with a down, slow, lower, and on 4 and 8, she would hold, and I say, don't let me move you, okay? So push up, down, slow, 1, 2, 3, 4, hold, 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 okay? We would go through that for 10 reps there on a couple sets. We would do this with internal rotation, 1, 2, 3, 4, and hold that there. Okay, again, a couple sets of 10 of that. Pushing up, down, slow, 1, 2, 3, 4, and hold that right there. Good. Prone internal rotation gets a little bit tricky. For them, it's usually called a brain melter, but we are pushing and you are slowly allowing internal rotation this way, okay? So don't let me push you out. 1, 2, 3, 4, and then hold it, 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 hold it. Good. And then lastly, the single leg hip lift. Okay, so pushing up, slow lower down, 2, 3, 4, hold it right there. Don't let it move, don't let it move, don't let it move, okay? We would usually do all of those in a circuit 2 times through, and if you're doing it right, it gets pretty intense for the lateral structures, but also the glute max in the back.